Hi there, my name is Dr. Bob Marcus and I created DDS GP. This video shows a little bit about the app, how it works, what it looks like. If you'd like a more in-depth look to see if it fits your particular needs, I encourage you to schedule a demo. We're happy to have a live video demo with you to show you everything in the app and kind of personalize it to your needs. Basically, here's how the app works. There's over 200 modules inside the app, and each module addresses one of two things, either a problem or a treatment. Maybe it's interproximal decay, and it shows how it enlarges and grows. Maybe it's cervical decay, maybe it's a crack, maybe it's a missing tooth, and it shows how the others tip in. Maybe it's periodontal disease, or pretty much anything you would need in your office. Then on the other side, we have treatments. Everything from an extraction to an implant. Everything from children's care to wisdom tooth removal, all the way up to periodontal disease and anything in between. The purpose of the app is this. Each module contains a set of pictures or illustrations that are designed to help the patient understand what's wrong with me, how bad is it, what happens if it gets worse, and what do I need to do to fix it? Now that may sound very rudimentary, but if patients don't understand all four of these in their mind, they won't be able to make a good decision, and they'll do things like saying, I've got to think about it. The best way to use the app is to go ahead and drag the little slider, the button at the bottom, to show the problem getting worse. Here I'm going to show periodontal disease. Here it's getting worse, and now here's what happens if the patient doesn't do anything about it. It gets really bad. And then we can drag it back, I recommend, to where the patient is now and say the good news is you're not at that stage. And then we could switch over to the treatment side of the app and say, here's the treatment. In this case, maybe it's scaling and root planing. There are so many diagnoses and treatments in the app, I can't possibly show them all in this video. If you want to see more, schedule that demo. The app also has many other features, such as a financial worksheet to help patients better understand the finances of treatment, as opposed to what comes out of our dental software, which can be confusing and have many numbers and words they don't get. It includes insurance if they have it. There's other features in there, such as saving your favorite modules so you can quickly jump to them. There's full-on treatment planning where you can save the modules that you're talking about with the patient onto a treatment plan, organize and annotate it, and then send it off via email or text or print it out. That's a treatment plan. What comes out of our computers is not a treatment plan. At best, it's a financial plan. So that's kind of the basics of how DDS GP works. It's meant to replace all the other stuff you're using to show patients. We don't need to show patients any more scary x-rays that they don't get. We don't need to show patients disgusting intraoral images that might provoke fear. What we're going to do is use these illustrations that are meant to be kind of gentle, but yet explanatory, to show them what's wrong with them. Now, if you do want to add your own photos or images to the app, you certainly can do so. We have an entire section in each module for that. But most doctors just use the illustrations provided. That's the really super brief overview of the way DDS GP works. I'd encourage you to go ahead and use it. We always say make a rule and make it used in every treatment plan, no matter how big or small. Get the at-bats in the small stuff so you can navigate the app quickly and efficiently for the bigger stuff. And we find that when we use the app in the office, whether it's the hygienist, the assistants, folks that work at the front desk, or the doctors themselves, we find when the app is used, case acceptance goes up because patients understand the value better and are more apt to say yes. Thanks for watching.